The following is an exclusive presentation of Cablevision local programming. TV that's close to home.
Hi, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today on Health Talk, we're going to talk about wrist replacement surgery with Dr. Paul Protomastro. And we're joined by his patient, Roger Curtis. Roger, welcome to Health Talk. Good to have you here.
Thank you, Eric.
Now, you've recently had your wrist replaced by Paul. Tell us your story.
Well, it starts in tennis, and it's going to end in tennis. It started in tennis.
And that's a good ending.
It started almost 20 years ago when I was playing at the net, and my partner decided that he was going to take a lob that was coming to me. Clearly, it was my ball at the net. I had my racket up ready to hit it, and he wound up hitting my wrist with his racket in a full hit. And that started the whole ball rolling.
Did you break something there?
Didn't break it, but it wasn't in good shape. And
Paul, what happens there? Is there damage that then plays out over
Roger
years?
had the most common cause of wrist arthritis, which is a tear between two bones, a ligaments that holds the two bones together, and that makes the wrist rotate out of alignment. So your wrist was out of alignment for years until you ultimately had to have an operation done to try to make that better, 10 years ago?
Yes.
So you suffered with it for a good 10 years.
I did, and a lot of cortisone shots in between until the doc said, no more, you've had enough. And then I knew I had to do something. So that took me to examining, what am I going to do next with this? And so I'd heard about one of my options was a PRC, proximal row carpectomy.
Right.
And I talked to various friends around who had experience with PRCs, and they led me to New York. They didn't lead me to the area. They said, go to New York.
That's actually a pretty common story. I always hear about patients going to New York City for their orthopedic surgery. And Paul is an orthopedist here. You must hear it too.
All the time. I mean, that's our #1 competitor. But I think it's a tradition. They provide high quality care. It's quite glamorous, physicians to the stars kind of things. But we've really come a long way here, and we provide a full spectrum of orthopedic care, making that trip unnecessary in many situations.
So, Paul, you didn't learn the lesson early enough, so Roger, so you went to New York. Tell us.
I did.
So then what happened?
It was 11 months ago. I went to New York, and I had the PRC procedure done. And then I went into, after the procedure, I went into therapy. I had the good fortune of choosing Lisa Maggiore over at Paul's group, Paul's hand therapy group. And she was working with me, but finally, after about 2 months, she said, Roger, there's something doesn't look right about this. I'm sorry, I don't feel comfortable working on you anymore until you get a second opinion.
So after all the planning and thinking and having a surgery, which is not a step that anyone takes lightly, 2 months later it still wasn't quite right.
It wasn't right at all. It was really, I wasn't sleeping, it was painful, and I'm afraid my New York doctor said, well, you shouldn't have any pain because I took out your bones. And I didn't really understand that because I still was in pain, and Lisa Maggiore didn't understand it either. And so I then took her advice, and I went to see Paul. And he did the x-ray, and he looked at it, and he gave me what the options were again, but he added one more option that hadn't been given to me before.
And we actually have your x-rays available. Paul, should we take a look at them? And you can.
Yeah, let's bring up the x-rays and bring the viewers right along with us. Here we are. So, Paul, take us through these. These are actually Roger's x-rays?
No, this is actually an x-ray of a normal wrist with the 8 little bones meeting the 2 long forearm bones and then the 5 finger bones. The next x-ray you'll see that Roger's wrist, the bones are starting to spread out. The bones are starting to get closer and closer to one another. And that's because his cartilage was deteriorating. He was having progressive arthritis.
So we can see those 8 little bones are all kind of smushed together
They're
now.
sort of clustered together,
Yeah.
trying to become one bone. That's what the body does. It tries to fuse the bones when it becomes arthritic. The next image will show the operation that was done. It was called a proximal row carpectomy. It means he had 3 bones taken out. He has a much simpler, smaller wrist. But the problem with Roger's wrist was that his arthritis was too advanced for this procedure to work, such that he was left still with an arthritic wrist. So the next image shows the solution that we offered to Roger, and this is called a total wrist replacement. The white things are metal, and they're not separated by air, they're separated by plastic. So this is now a metal and plastic joint which connects his hand to his forearm. And maybe we'll ask Roger how he thinks that worked for him.
Show us your wrist. Which is the wrist that...
You'd never know the difference. It happens to be the right wrist,
And
which is my dominant wrist.
And we're able to move that wrist, and that's that plastic and metal.
Plastic and
replacement.
metal. And I was able to do this very shortly after the operation.
Yeah. We should say it's only been a few months since you've had your
It was
operation.
4.5 months ago, Andrea. And in about 2.5 months, I was on the tennis court again playing. Well, I don't think the doctor wasn't too pleased with me playing quite so fast. But I was just hitting gently. But now, today I was on the court for 3 sets of tennis. No, it wasn't the pro league, but I was playing tennis. A lot of two-handed forehands, two-handed backhands. But I was playing a pretty good game of tennis, if I do say so. And so...
Was this the first time you tried out your new wrist
No,
for a full game?
No, I've been playing for about a month now, about 3 weeks. And I've also been playing golf. I'm not a golfer, but I decided to take up golf lessons because the doctor said, well, he's being a golfer, he's pushing golf. and so he said, golf for a right-handed person, golf would be a great sport for you because you do a lot of left-handed power with golf. It isn't a right-handed power job, and so sounded right to me. And I've been taking golf lessons now for the last 3 weeks, and I'm hitting them out longer and harder. But what I'm finding out is that it's technique. I'm not putting so much power into golf. I'm not so much power into tennis. I'm letting the racket do more of the work.
And does your wrist hurt you, or do you feel limited
I don't
by
feel
that?
a thing in it.
Have you noticed?
You did a good job. I don't feel a thing, and I've had no pain at night. So I'm a success story. I really am.
Pleased customer.
Well,
And I have to say one more thing that I owe Lisa a lot. She was there in the operation. I said, oh, look, I want them to make sure that we work on this hand.
This is our therapist, Lisa.
And she said she would. And so Lisa was right there, and she stuck with me, and I owe her an awful lot. But it's been a success story for the team.
That's wonderful.
It's important to say that this operation is not for everybody. We're very reluctant to do it in people under the age of 60. Why? Because orthopedic joint replacements are mechanical devices, and there's an analogy to like brake pads on a car. You only get so many miles. The more you brake, the faster they wear out. So take it easy on the tennis court, because they can wear out, and they can loosen, and they can require revisions, meaning where we have to redo them. And these are serious operations. There are risks, but we feel comfortable we're managing those risks, and the risk of complication is less than 5% now. So we'd like to offer it to more people who are suffering with wrist pain and who have given up their hobbies and their sports or even their occupation because of wrist pain.
Now, rheumatoid arthritis frequently affects the wrist joints. Is that amenable to this surgery in its advanced forms, or is there something about that?
It is in certain situations, as long as there's enough bone, the bone quality is high enough. There's other procedures that are done in rheumatoid as well.
Now, Roger, we're beginning to run out of time, but do you have any sort of final comments to the viewers? Because you've really been sort of run through the mill with this wrist joint, which now it sounds like it's at least in perfect working order right now.
I found out that local works and that the team works. And I just had the good fortune of running into the folks here at Norwalk to help me along the way. Why didn't I start with them at the beginning? Well, that's you. I've told the story. I thought I was doing the right thing, and it turned out that what happened for me was just a godsend. I'm very blessed. No, I'll take it easy. I won't hit the slams. And I know
more finesse now.
I'm now thinking of finesse and thinking of weight shift and more technique than power.
That's a wonderful story.
Yeah, this doesn't just apply to Norwalk either. There are sophisticated specialists up and down the coast of Connecticut, up to Hartford, and people don't need to travel to Boston or New York or to the Cleveland Clinic to get this kind of care. It's right here.
Sure.
Absolutely.
Great.
Paul, we have about 15 seconds left. Final words?
I think I'm blessed too. You know, Roger is a motivated patient. We have, we're blessed here. We have articulate, affluent, educated people, and we can take care of them and make them well and keep them busy.
And really to provide them the best care in the world. And so we're so glad to hear your story, and I think it's something we believe that that's true, but it's nice to hear from our patients that that's true as well.
My pleasure.
When we come back, Andrea and I will answer today's health questions. Here's this week's health question.
Hi, my name is Crystal. We're hearing so much about swine flu. How can we prevent it?
It's a really important question, and you know, we have been hearing a lot about swine flu. It's important to remember, first of all, that what's been called the swine flu is influenza. It's a variant of influenza, the H1N1 variant, and like all influenza, the most important thing to prevent catching influenza is to wash your hands.
And one of the nice things is that you don't necessarily only have to use soap and water. Those alcohol washes, the things that you can carry around in your pocket or your purse, do work. The more you wash your hands, the less likely it is that you'll track the virus from your hands into your eyes or your nose, which is the way most people, or your mouth, it's the way most people catch swine flu.
Again, if you are sick, please stay home from work or school to prevent spreading influenza or other viral illnesses.
It's tough because a lot of us want to be tough and want to go to work if we're not feeling well. But if you have an upper respiratory illness with a cough, particularly with a fever, do not go to work. If you do cough, please cover your mouth. Better not with your hands, but with your sleeve.
Absolutely.
So that you're not then taking the virus from your hands and putting it all over the place.
Absolutely.
And wash your hands carefully. Kids track stuff. They don't take as good careful precautions, so it's good to stay away from sick children as well.
Absolutely. And if you think you may have influenza, please see your doctor.
And if you have a question you'd like to ask on Health Talk, you can contact Andrea and me at healthtalk@norwalkhealth.org.
We'd like to thank our guests. See you next week on Health Talk.
Bye-bye.